Anna is a freelance designer. She is trying to choose a health insurance plan, but there are so many features that comparing the options turned into days of frustrating analysis. Let's help Anna understand what a plan is and the key characteristics of it. A healthcare plan is, in effect, the contract between the insured and the insurer, which details what the insurance will cover, coverage restrictions, and how the person and insurer will pay for healthcare services. There are 5 key features of any insurance plan. First, there's the plan benefits, the scope of healthcare services that the plan will cover. There are often 2 main types: medical benefits, which describe the physician services covered, including drugs that are injected or infused by a healthcare professional, and pharmacy benefits that cover the outpatient self-administered drugs that patients purchase from pharmacies. Specialty pharmacy, which includes very expensive medications that may require special handling, such as a chemotherapy drug, can be covered under medical benefits, pharmacy benefits, or in both categories. Prescription drug plans, or plans that have pharmacy benefits, will also have a feature called the drug formulary, the list of prescription drugs covered. Insurers often arrange drug formularies into different tiers that represent different cost levels. Tier 1 lists usually have the least expensive drugs, often generic drugs, while branded and more expensive drugs are in higher tiers. Insurers use the tiered system to control healthcare costs by imposing higher fees to patients for using more expensive drug options in high tiers. Next, plans have out-of-pocket costs, the fees that the insured incur when they receive healthcare services. There are 3 types: co-payments, flat fees that the insured pays to cover a portion of the cost of a healthcare service. Copay fees vary by the type of procedure and the site of care. Deductibles, the amount the insured must pay each year for covered healthcare services before their plan begins to share in the cost of services. For example, if you have a plan with a $2,000 yearly deductible, you'll need to pay the first $2,000 of your total cost of covered services, excluding copayments, before your plan can start to pay for your healthcare. Coinsurance, the percentage of the medical costs the insured pays after their deductible has been met. If you have a plan with a coinsurance of 20%, you will pay 20% of the cost of your covered medical bills, and your insurer will pay the remaining 80%. Most plans have out-of-pocket maximums, which cap the annual amount the insured will pay for covered medical expenses. The 4th feature of a plan is the provider network, the network of providers that a plan has contracted with to provide healthcare services to the plan's enrollees. Insurers use 2 models, broadly known as managed care and non-managed care models, to assign a plan's provider network. In managed care network, plans limit enrollees to specific networks of providers, aggregating the demand for healthcare services to give insurers better leverage in negotiating payment rates with providers. You might see plans referred to as HMO plans, or PPO, POS, or EPO plans. These are acronyms for the 4 main types of managed care networks, originally named after the organizations that offer each type, but today insurers would offer a mixture of the 4 types. All 4 types have in-network providers and offer different levels of flexibility to members in terms of provider access. They differ in 2 dimensions. Can enrollees see out-of-network providers, and can they see a specialist without getting a referral from a primary care doctor? HMO, or Health Maintenance Organization plans, are the most restrictive. Out-of-network providers are not covered, except in emergencies, and referrals are required to see specialists. PPO, or Preferred Provider Organization plans, offer the most flexibility. Enrollees can see out-of-network providers, though at higher out-of-pocket costs, and do not require referrals. POS, or Point of Service plans, allow enrollees to see out-of-network providers, but do require referral. EPO, or Exclusive Provider Organization plans, restrict enrollees to a list of local in-network providers, but referrals are not required. Non-managed care, the second provider network model, is the traditional model. Non-managed care plans can limit enrollees to a network of providers, or they may not have a provider network at all, allowing enrollees to see any provider that accepts their insurance. There's also no need to get referrals to see specialists. Insurance under this model typically incurs the highest cost for the individual, compared to equivalent managed care services. Finally, plans will have a premium, the monthly amount that is paid to insurers to purchase an insurance plan. The other features impact the premium. The premium will depend on the plan's benefits, the flexibility of provider access, and the out-of-pocket costs of the plan.